So, Doc, you were just in Los Angeles, right? And you called parts of it the epicenter of healthcare fraud. Now, before we get into the nitty gritty of this, what kind of fraud are you talking about, and what is the scope?
So let's talk about the kind of fraud because it's particularly alarming that we're seeing hospices, which again are designed for people who are terminally ill and are going to die within 6 months. We see home health care. These are services provided to people who need desperate support in their homes. So they're trusting someone to come in there and provide these services. We see fraud in home and community-based services. These are the kinds of things that your family would do for you normally, but for whatever reason, your family is not around. So
Right.
driving you to a doctor's appointment, getting you home after hospitalization and taking care of you and bathing you and bringing the groceries up for you, do the shopping, all the kinds of things, again, that your family would do. But since there's no licensed professional involved in that arena, there's a lot of fraud possible because I don't have a doctor's license. I don't have some of the classic things you have to tell if you had a hernia operation, where I've got a lot of different ways of figuring out that it actually happened. So that's the kind of things we're talking about. Put some numbers on these. There's been a sevenfold increase in hospice services in California. I mean, Jillian, unless there's 7 times more people dying in California than a few years ago, there's a problem here. We have home health care building in Southern California, in LA County in particular, that represents 9% of all of the billing in America, like the entire
Wow.
country. That's
Wow.
that's 5 times more than you'd expect. So again, just the numbers themselves reveal deep fraud. And the problem that I'm forced to tackle is how did it become so systemic? Endemic. It's all over the place. When I was talking to whistleblowers and doctors who still were doing these sort of suspect practices and patients who'd been harmed, I kept hearing horror stories where it's sort of commonplace now in Southern California to pay a doctor to get their patient into your hospice facility, to buy beneficiary numbers. So you go to people on Social Security and you actually buy their numbers. There's a whole market for this. You
What?
can buy hospices for a couple $100,000. I'll tell you, this is a true story. I was talking to this guy who owns 5 different hospices, which, by the way, in itself is a question mark of like, why do you own 5? I can just own one and do it right. They
Okay.
buy 5 because if you keep the number of patients in each hospice small, you don't have to report to the federal government. Anyway, he's building a
Oh,
massive house,
wow.
Jillian, a beautiful house apparently that he's telling me about with all these ill-gotten gains. The plumber knows that he's in the hospice business, and he says, "Hey, boss, guess what? I got a side hustle. I'm not just a plumber. I got a hospice too." And then the carpenter overhears the plumber talking to the hospice owner and says, "Hey, me too. I got a side hustle." So all the contractors own hospices. And I'm thinking, well, what's going on here? Obviously, people realize it's a gravy train. And because no one's watching the shop, everyone's walking in there and stealing as much as they can get into their pockets. And that's a problem. And that's the reason that Governor Newsom and I are having a little bit of a spat right now because I'm calling him out on it. And he can make up stories about, why I'm targeting this group or that group. It doesn't matter to me. I know what's going on with the fraud in the area. These are federally adjudicated cases. There are court documents that he can look at himself. It's pretty evident what's going on. And it's not limited to just one community, but there's some places where it's so obvious. If you've got hundreds of these little hospices and home health care groups in one building, I mean, what gives? There's a possibility that the landlord of that building knows that he can rent out all of his offices to small-time operators who are fictitiously providing services. It's a hypothesis, but it's proven to be true in other parts of the country, like in Minnesota. I know it's also true in parts of California. So why not open your eyes and deal with the problem instead of attacking the messenger?
All right, everyone. As we kick off 2026, I'm all about bold action. Taking that idea that you've been nurturing and turning it into a reality. So whether it's launching your own fitness apparel line or your wellness supplements or just a passion project, don't let it gather dust. This is your year to build something epic. And with a tool like Shopify, there are just no excuses. They give you everything you need to sell online and in person. Hundreds of stunning customizable templates to match your brand, built-in AI tools that write killer product descriptions, generate headlines, and even edit photos in seconds. Marketing's seamless. You can create emails and social campaigns that meet customers where they scroll. And as you scale, Shopify grows with you, handling more orders, new markets, all from one intuitive dashboard. Millions of entrepreneurs, from breakout brands to solo creators, have made the leap. And I know the power of owning your own vision. I've done it. I have a business that uses Shopify called Alaya Naturals, and it's been a game changer for us. So get started today and make this your breakthrough year. In 2026, stop waiting and start selling with Shopify. So sign up for your $1 per month trial and start selling today at shopify.com/Jillian. Just go to shopify.com/Jillian. That's shopify.com/Jillian and hear your first this new year with Shopify by your side. So I want to understand this quite literally. You just said fictitious. There's no hospice at all. So it isn't like they're running a hospice and then just billing for things they didn't do. They're buying my social security number, hypothetically, pretending I'm, let's say, a stage 4 cancer patient, and pretending to give me hospice care and billing the government for it. And there's no hospice happening whatsoever, like daycares without kids kind of a thing?
Well, I think it's actually a bit more complicated. That's what you described is actually true for durable medical equipment, where you're selling wheelchairs or knee braces, but not really.
Okay.
Those are called bust outs, where you don't sell anything to anybody. You never ship a product. You have no inventory. You have no cash flow. You have no employees. You're literally a fictitious building. And by the way, that's very common in South Florida. And in South Florida, it's actually the Cuban community that seems to unfortunately gotten pulled into this process. And the Cuban government, we think, is involved as well.
Wow.
In Los Angeles, it started with the Russian community. And we know that because when convictions were handed down, the perpetrators escaped to Russia. Literally, they ran back to their home countries. So these aren't even Americans involved in many of these fraudulent activities. Hospice is a bit more painful to admit. What happens in hospice is they'll knock on your door. You're, an older person, and this young, healthy person says, "Oh, I love taking care of older people. I really want to be able to be part of your life. Can I help you? Listen, I can get you a free TV or something, but I want you to sign up for this program, which will help you get better care." And what they're really doing is tricking the person to signing up to hospice. Now, Jillian, this is really important to understand. Hospice works for people at the end of their life. The deal is we will give you extra stuff to make sure you're comfortable. In return, you give up your Medicare. You give up access to all the regular care you would normally get. And the company that does this takes that money that we would have paid to Medicare for you and uses it to make your life more comfortable. Now, if you're not ready to die because you're not terminal, when they do this, they pull you into a different system. They now no longer let you go back and get regular care. And I talked to a family whose loved one died. Her brother died after this happened because he could not get regular care afterwards, even though he was very treatable. Now, let's go back to the story.
Okay.
Why do I think this is happening? Jillian, if I told you were terminal, dying of cancer, God forbid, the chance of your dying should be, in many cases, 70, 80, 90% over the next 6 months. It won't be 100%, but it's going to be pretty high. The mortality rate for many of these hospices, follow the bouncing ball, is 0. No one dies. Now, that's highly unlikely that you got it all wrong, that nobody died on your watch. So we know that there are lots of these fraudulent facilities. Now, because they're so small, under 50 patients, they don't have to report. We don't actually know what's happening. Are they fake patients? Are they tricked patients? Are they patients that weren't going to die and should never have been on hospice? Are they people with Alzheimer's who might not die in 6 months? It's a mix, but these companies hide behind this. And this is the problem. When I met with the U.S. attorney in Los Angeles, he was furious that he had not gotten leads to act on because you actually need to understand how these scoundrels work. And they are diabolically clever. And I'm going to say it again. Many of them are foreign nationals supported by foreign governments. They send their money back to where they came from originally, and they escape to those countries when we come after them, which is why my job is to stop just trying to put them in jail, but actually act to never let them get started in the first place, which is why I came to California, visited with whistleblower groups, patient advocates. Some of our biggest allies in these investigations are the legitimate providers of hospice and home health care. Because, for example, the home health care business is being decimated around the country because so much of the money is getting sucked to Los Angeles. There's not enough left for the rest of the businesses, so they're actually shutting down. So they want us to do our job, and that's why I'm asking Governor Newsom, do your job. Stop obfuscating. Don't pretend. This is a real problem. People are dying. Act that way.
All right, guys, if you like this clip and you want to watch the full episode, click here. And if you want more content like this, you can subscribe to the show by clicking here.